Hi, I'm Bill Patten, CEO at Holy Cross Medical Center. Today I want to give you an update from the board meeting that was held on December the 8th. As is our custom, the board combines the November and December meetings into one meeting. We began the meeting with a strategic planning conversation. The board has been looking at what the issues are that Holy Cross needs to address in order to meet the community's needs from a clinical services perspective, but also to be financially viable for the long term. The board spent a couple of hours reviewing information related to these questions and will continue to take up these topics at its January meeting. The board also reviewed a number of physician contracts. It approved renewals for our 3 general surgeons, Dr. Doherty, Dr. Flanagan, and Dr. Darnell. Also, the board approved a contract for Dr. Veronica Parker. This is part of the acquisition that we recently announced of Taos Clinic for Children and Youth, Dr. Sylvia Villarreal's clinic. As we announced in a press release recently, Dr. V, as she is popularly known, is retiring. And the Holy Cross is stepping in and will be taking over the practice to continue the great pediatric service that her clinic has provided to the community for many years. Dr. Parker's contract was part of that transition. The board also looked at replacement of 2 important pieces of equipment, our CT scanner and our fluoroscope. Both of those pieces of equipment are past their normal useful life, and we've been seeing higher than acceptable amounts of downtime, especially with the CT. That really affects our ability to provide timely care in the emergency department. On average, we're doing 700 to 750 CTs per month. Jeff Skank and Sue Romansky had done a great job putting together proposals for the board and had come up with a creative way to install a new CT scanner without having to use a portable, a scanner that would be in a semi-trailer. The board was very appreciative of the creative work that had been done and approved the purchase of these 2 pieces of equipment. The total is about $1.1 million. We will be using mill levy money for these. And I think it's important that the community know the ongoing commitment that we have to honor the agreement that we had when we asked originally in 2016 for mill levy support, and then when it was reauthorized just last year. We are responsibly using mill levy funds for medical equipment and for maintenance and repair of the building, just as we said we would. These 2 purchases highlight that. On the CT side, we're not just replacing the current scanner, we're actually going to do an upgrade. We're going to be buying a 128 slice scanner, not meaning to get too technical, but the more slices you have, the more detail that you can see. Also, the more slices you have, the faster a scan can be performed with less radiation. So this will be a great advancement for our imaging department, and we're appreciative of the board providing that support to the organization. The board also received an update regarding our financials from October. Again, because the November and December meetings were combined, we don't have November financials yet. But October was reflective of the high volumes that we continue to see. We are seeing some COVID volume, but COVID isn't what's driving our volumes these days. We are seeing what I call traditional sick people, and a lot of them. The hospital is much busier than we typically are this time of year. So we had a very positive month financially in October. Also, our days cash has been very strong. We continue to shepherd the money that we received from the federal government. We are in the process of repaying what was called the Medicare Advanced Payment Program money. We still have about $4 million there that we need to repay. We received that money just in case we needed it. As it turned out, we didn't, so it's a planned repayment schedule that we're under. So financially, the hospital has had 3 very solid months in a row. We're expecting November to also be good numbers, again reflective of the high volumes that we're seeing both inpatient and outpatient. The board talked about medical staff recruitment. As I announced last month, Rural Radiology, the radiology group that has provided great service to our organization for many years, gave us notice that they were going to be ending that contract. So we went through an extensive process looking at viable alternatives. We settled on Radiology Partners. That contract will go live the 28th of December. We also are working to stabilize our cardiology program. We're in conversations with Loveless. That program continues to have a lot of time and energy devoted to it. As I mentioned last month, our CNO, Pam Aiken, has left us. Brittany Lamandola and Renee Laughlin have stepped up and are serving as co-interim CNOs. I have hired a permanent interim. I know that sounds sort of funny, but while we're recruiting for a long-term permanent CNO, we're going to have someone starting the 10th of January that will be able to step in and fill the CNO shoes. On the operations front, we have a number of supply chain issues. Last month it was crutches. This month it's 60 cc syringes, and at times some of the gowns and special masks that we use. There's no telling what the issue will be. The good news is that all of the personal protective equipment that we need, especially as it relates to taking care of COVID patients, that we're not having difficulty getting adequate supplies of. But our materials department has done a great job finding alternative vendors as we face these unpredictable supply chains. You hear about it in the news, and it's interesting how it affects us on a local basis in very unpredictable ways. Our staffing continues to be an issue that we have to work on every day. The number of travelers that we have continues to be higher than we would like. And it's a national challenge that we face. The pandemic has caused a lot of people to leave healthcare, people to retire early. So the supply of staff is lower than we would like, and the cost of staff is higher than we would like. In addition, having dealt with the pandemic now for the second year, folks are just getting tired. In the beginning of the pandemic, healthcare providers were celebrated as heroes. Now, patients also are tired, and they take out their frustrations on healthcare workers. I would urge you to be patient when you come to the hospital, when you go to your doctor's office. Some of the rules that we have to follow, masking, for example, that's not our idea. We have to comply with regulations from the state and the federal government. We do intend to take care of you the best we can, but if the wait is a little bit longer than you would like, I would encourage you to be patient. Don't take it out on the healthcare employees. Swearing at them, spitting on them, that doesn't do anyone any good. So please, this is a hard time for our employees as we continue to deal with COVID patients and folks that are passing away at a rate higher than we would like. I would urge everyone to take a step back and be calm. I also updated the board on some IT issues that we've been facing recently. As everyone knows, ransom attacks are very common. Well, we weren't attacked from a ransom perspective, but we did have an attack on email systems. It's called spoofing, where they get into your email system and then they send out emails to everyone and their brother, and they have dangerous links attached to these emails. They look very real, very original, official, but they are not. So our email system has been offline for the better part of a week as we scrub the system to make sure that it's clean. We're grateful that we didn't have a ransomware attack, but just our email system, it made us realize how vulnerable these systems are, that the folks that have desire to do bad things to computer systems, they have lots of time on their hands, and we're suffering the effects of that. Want to do a shout out to the IT team. They have done a great job cleaning our system. We hope to be back up early next week. And finally, The board was very grateful for the work that the medical staff and the employees have done over the last year, and we had negotiated with our union a special end-of-year thank you retention payment to our employees that went into effect today, Friday the 10th. So I just want to add an additional word to all of our employees. Thank you for hanging in there. You are very valued, and the little gifts that you received are just a token of the esteem and the respect that the board and hospital administration have for you. Thank you for your service to Holy Cross Medical Center and to the Taos community. Have a happy holiday. Thank you.